Welcome back. I'm the Intense MD, a double board certified intensivist, here to give you an inside look into the intensive care unit. Today, we're going to step away from the ICU and I'm going to talk about in-flight emergencies. I have had people ask me, when I say I'm a doctor, they'll say, well, have you ever had help on a plane? And I have. So I'll tell you a little bit about that scenario, but I'm also going to talk about in general what happens when there's an in-flight emergency, what's available to the people who, volunteer to help, and kind of what decisions need to be made and some common reasons for medical issues at a higher altitude. If somebody alerts the flight attendants that there is a medical problem, they'll call on the overhead and ask if there is a doctor on the plane. And you are at liberty to volunteer efforts or not, but I did not have a problem, helping out in that situation. So they'll call for the doctor on the plane, you get up, you provide medical assessment, and they bring you a bag that has all of this equipment in it. And the Federal Aviation Association, the FAA, which is the governing body for airlines in the United States, requires certain things to be in these bags. So there is a minimum amount of contents to these bags and types of things that must be in the bag, but many airlines will have even more things in the bag. So I'm going to put up on the screen what is typically found in the bag. I'll just read off a couple of them. Sphygmomanometer is a blood pressure cuff, a stethoscope I'm sure you've all seen before. But they also have several things for airways, for CPR. They have some things to start up an IV, and they have several different medications as well. So I'm just going to explain what some of these medications are for if they don't seem familiar to you. So antihistamines are for allergic reactions. So that would be something like a Benadryl. Atropine is usually used in emergency situations if somebody's heart rate is very low. Aspirin is most likely if you think somebody is having a heart attack, you'll have them chew on some aspirin. Bronchodilator is an inhaler, so if somebody's having an asthma attack or their COPD is flaring up. Dextrose is sugar, so if somebody's diabetic and their blood sugar drop. Epinephrine is either for anaphylaxis, so they'll have some airlines will have an EpiPen where you can inject this into the patient if they're having a severe allergic reaction, but it's also used in the setting of cardiac arrest when the heart stops. It is a medication that we use to try to, promote the heart to contract. Lidocaine, it can be used for a couple different things. If you think about it like at the dentist, Novocaine, lidocaine, they're cousins, so it's a numbing medication. It can also be used for irregular heart rhythms in emergency dosages. Nitroglycerin tablets are for a heart attack. And then I found that other airlines might have other certain things on board. So an automatic electric defibrillator, an AED. An AED might be available in many public places. This is if somebody is suffering cardiac arrest. It is something that if you don't have any medical training in terms of advanced cardiac life support, you don't know how to read the rhythm that the device is giving back to you, this will automatically read the rhythm and tell you if the patient should be shocked or not, if they have an abnormal rhythm. And it's used in the setting of cardiac arrest. I also found that a lot of airlines will carry anti-nausea medicines because that's one of the most common complaints on a flight is somebody feels nauseated. So typical situations when somebody travels and has a medical problem, well, like I said, nausea is one of the big ones. Another thing that can happen if somebody has lung problems at baseline and they go up into altitude, there's less oxygen up there. So they might have issues with their breathing. There are some patients who unfortunately cannot do air travel because of the severity of their lung disease. So in those situations, we'll tell them to, maybe drop the altitude of the plane a little bit if they can. And they a lot of airlines will have supplemental oxygen take on board to give to the patient until we can land. Another scenario might be some stomach discomfort, pains in the stomach, and that can also be due to the high altitude. So one of the things you can do first is trying to drop the altitude of the plane and see if that helps. And then, of course, there are the medical problems that can happen on ground that just happen to occur during somebody's flight. So, like I said, cardiac arrest, heart attack, stroke. These are all things that can happen at any time. So being on a plane does not exclude you from having a medical emergency. One of the big things that the doctor who volunteers needs to decide if we can continue what we're doing and continue at our current pace, or if we need to land this plane as soon as possible, whether it's at the airport that the final destination is, or cut the flight early and land at the closest airport. So in my situation, I was still in training. I believe I was in my first year of critical care training. So I had already finished medical school in internal medicine, and I was visiting my, at that time, fiance, because we did not live in the same city for our medical training. On the flight, there was a woman who passed out, and everyone's like, oh my gosh, she passed out. So then they asked if there was anybody on board who can assist. So I went, I evaluated her. She's kind of telling me different symptoms she was having. They gave me the medical bag. So I opened the bag and there's a stethoscope, but it's like a junky disposable stethoscope. And I tried listening to her heart and lungs, and I didn't hear anything abnormal, but I also probably wouldn't have unless it was very loud, because like I said, the quality of the stethoscope was poor and the engine of the plane was so loud it was difficult to hear. I was able to manually take her blood pressure and it was low. So after talking to her, I'm like, we got her something to eat, we got her a little bit of oxygen, and given some of the things she told me, I'm like, well, you could be having a heart attack based on, your blood pressure's low. You're telling me you have these things in your medical history. You felt this way before you got on the plane. I said, you need to go to the hospital after you land. And she's like, no, I parked my car in the lot. I'll be fine. I'll drive home. Maybe I'll call someone. I'm like, my recommendation is that you go to the emergency room. So once the flight attendants heard this, they're like, oh, we need to land this plane. So the lady finally agreed that once we landed, she'd go to the hospital. But what got orchestrated on the ground is they were able to land us at our final destination about a half hour early, and they had an ambulance waiting there on the tarmac for her. So they took her off the plane first with the EMS, and then everyone else was able to leave at the gate. So some people got kind of frustrated because we landed and then we had to wait. And some people around me were kind of making comments, and I was like, well, we still landed early, so I don't know why you're annoyed that you have to wait an extra couple minutes for her to get the medical attention she needed. But she didn't have anything wild going on, and it wasn't a situation that you see on TV or movies where, there's all this chaos. And there definitely are in-flight emergencies that are like that, but a lot of the in-flight situations where, I've talked to several people who have been involved in in-flight emergencies. Sometimes it's just very simple things. Someone might be having anxiety, somebody might be having nausea, somebody might be having, stomach pain or such. But like I said, there are times where it can be a bigger problem. Oh, and something else that people are usually curious about is you can't accept payment for volunteering on a plane. You volunteered. You can't send the patient a bill. You can't expect the airline to give you anything. I've heard sometimes people get upgraded to first class for the rest of the trip, but you kind of just, as a good Samaritan, volunteer your expertise and help them the best you can, and that's it. So I know some people are like, oh, how much do doctors get paid after they do that? Well, nothing. Sometimes the airline might give you something, like I said, an upgrade or maybe a small like gift card or voucher, but we can't accept payment for that. I hope you enjoyed this video, and I will see you next Thursday for the next one.